Okay, so we're going to discuss today about the complement system. Okay, so our complement system was then discovered by Paul Ehrlich. So it's being called here the complement because it's try to complement actually the activity of your antibody in the elimination of your foreign antigen inside our body. So it helps also as our defense against the removal of your pathogen that enters our body. Okay, so all our complement components here are actually produced by our liver being a protein, okay, except your C1 is being produced here by our intestinal epithelial tissue. And we have also here the part of your alternative pathway. We have here the factor D, which is being produced here by the adipose tissue. Okay, so we have here the three pathways of our complement system activation. So the first one, we have here the classical pathway. That one is antibody dependent. This one is being activated primarily by your antigen antibody complex. So it needs to be activated here by the formation of your antigen antibody complex that is being deposited to the different tissues in your body. The second one, we have here your alternative pathway, or you call this one your properdin pathway. So before, they thought here that um, the properdin is the one responsible for the activation of our alternative pathway. It was then later found out that the properdin takes its role here as responsible for stabilizing the enzyme complex, especially your C3 convertase of this pathway. And this one is activated not by our antigen antibody complex, but most likely this one is being activated here because of the presence of your bacterial infections, because the presence of for example, the gram-negative cell wall of your bacteria containing the LPS, lipopolysaccharide. And the third pathway here, we have your mannose binding lectin or Manan binding lectin pathway. So this is a pathway where this one is being activated by the presence of your carbohydrate mannose in the surface membrane of your pathogen. So if your surface membrane of your pathogen is made up of the mannose, so it try to activate your MBL, mannose binding lectin pathway. Okay, so the activation of our complement system try to result to the following. The first one we have here the cell lysis. So again, as part of the consequence of removing here your antigen antibody complex deposited in your tissue, try to cause here lysis. So it's not only that it try to remove your antigen antibody complex, but it also try to cause damage to the tissues where that immune complex being deposited. Especially if you have already the activation of your membrane attack complex, your C6, 7, 8, and 9. Another one of part of the activation of your complement system, try also to produce here several products. So the products here may serve as your chemotoxins. So when we speak about the chemotoxins, so these are the products which try to attract your phagocyte toward the tissue injury. So your chemotoxins in the form of your C3A and we have also your C5A. So other component here serve as your opsonine. So when we speak about the opsonine, it's try to coat our pathogen that would render your phagocyte to recognize or becoming your pathogen here to be tasty to your phagocyte for recognition that one is your pathogen and that one should be engulfed by your phagocyte. So that's opsonine. Example of your opsonine here that is a complement component would be your C3, your C3b. And we have also here some of our complement components serve here as your anaphylatoxins. So when we speak about anaphylatoxins, so this one try to trigger the degranulation of your basophil and mast cells in order for that to release the histamine. And the histamine here is responsible for the manifestation of our allergic reaction. So example of your anaphylatoxin, we have your C3A, C4A, and we have also your C5A. Okay, however, overactivation of your complement is not also good. It can also lead to your tissue inflammation, tissue damage, or worse, it can also lead to your autoimmunity. Okay, so we have here the activation of your classical pathway. So again, our classical pathway is activated by your antigen antibody complex. Okay, that one. So you should have your antigen antibody complex that is being deposited in your tissues. Okay, and we have here the members of our classical pathway. So we have here the complement components involved. So the first one, we have here the recognition unit. The recognition unit here would be your C1 complex. Our C1 complex is made up of your C1Q, C1R, and we have your C1S. Followed here by the activation unit, which includes your C4, C2, and we have also your C3. And then we have here the first member of our membrane attack complex, C5, C6, and 7. And finally, we have here the final membrane attack complex made up of your C8 and the C9. Okay, again, you start with the activation of your classical pathway by the formation of your antigen attached and your antibody attached to your surface of your tissue or cell. Like, for example, this one could be deposited in your kidney or glomerular membrane. Because of that one, it will activate our classical pathway. Again, the first going to be involved here for the activation of your classical pathway would be the recognition unit. Our recognition unit is your C1. Again, this is a subunit, a complex primarily made up of the following subunits. C1Q. Our C1Q, we describe this one as your made up of 6 globes. 1, 2, 3, 4, 5, 6. And they have here the slender na shaft, okay, fused in a common base. Okay, so this one will eventually attach to the FC portion of your antibody. Okay, there are only two antibody that is capable of complement fixation. We have your IgM and your IgG antibody. So, dapat itong antibody naka-attach sa ating antigen with your antigen-antibody complex. Form here should eventually can either be your IgM or IgG in order for that to activate our classical pathway na complement. Okay, so this one, we're going to bind here the globes of this one. We're going to bind the two of that. We're going to bind here, okay, to the FC portion. If your antibody is an IgG antibody, it will bind specifically here to the CH2. Okay, but for that, you need dalawa dapat na IgG na antibody. So, dito siya magbabind dito sa isa, saka dito mag-isa. Okay, because remember that your IgG antibody is a very small antibody. On the other hand, it can also bind, the globe here can bind also in the FC portion of your IgM antibodies, specifically that one is in the CH3. Okay, but you've been needing only here one na IgM antibody because again, your IgM is pentamer, so 5. So pwede na siya. One IgM lang is already enough to activate here the entire classical pathway. And once your your C1Q able to bind on this area, the FC portion, it will allow also the binding of your C1R, then followed by your C1S. So therefore, that become your C1 complex. And your complex, okay, C1Q, C1R, C1S, will be stabilized here by your calcium. In the absence of the calcium, it will not able to form, it will not be stabilized, it will decay. And it could not proceed with the next complement system or the complement factor here, complement system activation. Okay, so the next thing we're going to happen is that if you have already your C1QRS complex here attached to the FC portion of your antibody, it will activate. Next would be the first activation unit. Okay, so the first activation unit will be your C4. Okay, the C4 will be cleaved. Okay, so I need to say it will hydrolyze your C4. We're going to cleave or hydrolyze your C4 here would be your C1S. Okay, the C1S, we're going to cleave your C4 to your C4B and C4A. Okay, so the C4A will be released to your plasma where it acts here as your anaphylatoxin. Diba kanina, we have discussed example of your anaphylatoxin, and your C4A is part of your anaphylatoxin. Then what's going to happen here with your C4B? Your C4B, we're going to bind here on the surface of your antigen. Hindi siya dito magbabind sa ating antibody, but on the surface of your antigen. Surface membrane of your antigen. Okay, the next here would activate your C2. Okay, the C2 will be the next going to be activated. This one will be cleaved again by your C1S to your C2A saka C2B. Okay, the C2b will be released to your plasma. Wala siyang function. And the C2a, ang naiwang C2a will going to bind here, okay, with your C4b to form here your C4b C2a. Okay, so you have your C4b C2a, and you call that one as your C3 convertase. Again, your C3 convertase here are your C4b C2a complex. Okay, so this one, C3 converted here, should be stabilized also by your another ion in form of our magnesium in order for that to prevent decay. Okay, the next thing, if you have already your C3 convertase, so ano ginagawa ng C3 convertase? Okay, your C3 convertase, we're going to cleave our C3 to your C3b and we have your C3a. Okay, then eventually we have your C3b. Okay, I mean your C3a will be released to your plasma that can act here as anaphylatoxin. This one is also act here as your chemotoxin. Then your C3b, ano mangyari kay since ito ay na-release sa plasma? So ito ang matitira, C3b. Your C3b here, we're going to bind to your C4b, C2a. So C4b, C2a plus your C3b, that become your C4b, C2a, C3b. Okay, you call that one as our C5 convertase. Okay, so next, if you have already your C5 convertase, it will cleave your C5, okay, to your C5a, and we have your C5b. Okay, so the C5a will be released to your plasma because it can act here as your anaphylatoxin and chemotoxin. And the C5b will going to add here to your C4b, C2a, C3b complex to become your C4b, C2a, C3b, and C3. And we have here your C5b. Okay, next, if you have already your we have your C4b, C2a, C3b, C5b. Next, here, you're going to activate your membrane attack complex. It will activate your C6, 7, 8, 9. That's your membrane attack complex. This is responsible here for the cell lysis. Okay, the C6 component of your membrane attack complex here, try to stabilize your complex, your membrane attack complex, or C7 component here, try to hydrolyze primarily the lipid component of the cell membrane. It will also allows the insertion of your C7, okay, primarily to your cell membrane. And the C8, on the other hand, try to hydrolyze the hydrophobic component of the cell membrane. Also try to create hole or butas. Okay, and because of the hole here, it try to eventually resulting to the loss of your potassium, to your amino acid, RNA, and accumulation of your water and sodium, and eventually resulting to your cell lysis. If for example here, your antigen, dito siya naka-attach, for example, sa RBC natin, activation up to your C8 can already result here to your cell lysis. However, if your antigen-antibody complex has been attached to your WBC, you still need to activate here the last member of your membrane attack complex, which is your C9, okay, to cause here your cell lysis. So, ganun siya. Gagawa sila ng butas, okay, then eventually, mag-rupture ito, and eventually, that would allows, okay, the lysis of your cell here where your antigen-antibody complex has been deposited. Ang problem lang dito, like for example, if this antigen-antibody complex has been deposited in your glomerular membrane or sa kidney natin, as it try to remove your antigen-antibody complex by the action of the activation of your complement system, it also try to damage. Binubutas niya. Hindi lang enough na tatanggalin niya sa antigen-antibody complex, but also try to damage your tissue kung saan naka-attach ang ating antigen-antibody complex. If that one has been attached to your glomerular membrane, it try to disrupt here the membrane of your glomerular membrane, glomerulus, and eventually that results to your kidney problem or kidney damage. Okay, next we go to your alternative pathway. So again, the alternative pathway, other name for that is your property pathway. So this one is not activated here by your antigen-antibody complex. This is your antibody-independent complement system. Basically, that's why it's being activated here by your gram-negative cell wall lipopolysaccharides. So if your pathogen, for example, is made up of your LPS, like in the case of your gram-negative bacteria, so it can activate your alternative pathway. Okay, so activation of your alternative pathway start here with your C3 being cleaved by your cobra venom factor, cleaving that one's your C3b and your C3a. Then again, the C3a will be released to your plasma, mariretain ang C3b natin. Ito na siya, C3b. Okay, next we have here another component, factor B. Okay, it's being cleaved here by your factor D. Cleave your factor B to your BA and your BB. Then the BB here, the BA will eventually be released to your plasma at ito ang maiiwan, BB. Since kanina meron kang C3B dito, so ito na siya. Then another one, we have your BB na retained dito. Then what you have here would be your C3B, BB. And you call that one as your C3 convertase. To prevent the decay of this C3 convertase, it should be stabilized here by your magnesium, and we have also here your properdine. Kaya tinawag itong properdine pathway because again, the properdine takes part in stabilizing your enzyme complex. Okay, so being a C3 convertase, so it try to hydrolyze your C3 to your C3A and your C3B. Then again, the C3A will be released to your plasma, retaining your C3B. So magko-combine siya dito. C3B, BB, 3, C3B. Or you can call that one C3B, BB, 3B. Okay, you call it one your C5 convertase. Okay, the C5 convertase here in your alternative pathway would be your C3B, BB3B. And being a C5 convertase, I try to cleave again your C5, okay, to your C5A and your C5B. Okay, again, your C5A will be released to your plasma. It can act here as an aflatoxin and also act here as your chemotoxin. Then we have your C3B will be retained. It will able to combine with this one, so form C3B, BB3B, 5B, which is eventually activating our membrane attack complex. So pareho kanina sa ating classical pathway, it will activate your C6, 7, 8, 9, and eventually also resulting here to the lysis of your gram-negative cell wall or gram-negative organism. What have you noticed here in our alternative pathway? So we have here mga new complement components. So we have the factor B, factor D, cobra venom factor. At wala tayong itry to bypass. Actually, ang classical pathway natin, wala itong C1, wala siyang C4, wala din siyang C2. Diba? So, you start with a C3, C5, C6, 7, 8, 9. Okay, so, yun. Yun ang pinagkaiba niya sa alternative. Yun ang pinagkaiba nitong alternative pathway natin sa ating classical pathway. Okay, the next pathway we have here, your mannose-binding lectin pathway. So, this is the pathway of our complement that's being activated primarily by the presence of the mannose as part of the component ng surface membrane ng ating pathogen. So what's being activated for that would be the MBL or mannose binding lectin. Okay, the MBL would be equivalent to the C1 complex as part of the recognition unit in your classical pathway. Okay, the MBL would eventually try to bind in the mannose to try to activate your MAS P1 and the MAS P2. Okay, so MAS P here stands for your mannose binding lectin associated serine protease. This is a proteolytic enzyme. So I try to hydrolyze here other complement component. So what's really involved here would be your MAS P2, which act here as your C1S with our classical pathway. So your MAS P2 try to cleave. So pareho siya ng ating classical pathway. Try to cleave here your C4, converting that one to your C4A and your C4B. Okay, that C4A will be released to your plasma that will act here as an aflatoxin. You try to retain your C4B. Ito na sa C4B. Okay, then your C2 will then eventually be cleaved by your MAS P2 pa din because again, this is equivalent ng ating C1S and our classical pathway that will cleave your C2 to your C2A and your C2B. Again, your C2B, will be released to your plasma because this one do not have a function. And it will just decay on that. And your C2A will be retained. It will able to bind here with your C4B to form here your C4B to a complex. And that we consider that one as our C3 convertase. So our C3 convertase again, just like your classical pathway, try to cleave, hydrolyze our C3 to your C3A and your C3B. Okay, which eventually your C3A will be released to your plasma, which act here as anaphylatoxin or chemotoxin and able to retain your C3B. And the C3B, we're going to bind with your C4B, C2A, okay, to form here our C4B, C2A, C3B complex, and that become here our C5 convertase. And our C5 convertase try to hydrolyze or cleave our C5, cleaving that one to C5A and C5B. And the C5A will be released to your plasma wherein it act here as your chemotoxin and anaphylatoxin. Okay, the C5B, you're going to bind to that to form here C4B, 2B, C4B, 2A, 3B, 5B, which is eventually activating here the last unit of your complement, which are your membrane attack complex, C6, 7, 8, and 9, and eventually resulting here to the lysis of your manus, the surface membrane ng ating pathogen. Okay, so almost pareho lang din ang ating manus binding lectin pathway with your alternative, with our classical pathway. Okay, so we have here inactivation of our complements. So these are actually the different conditions that can inactivate your complement. The first one, we have your anticoagulants. So in the presence of your anticoagulant, it try to destroy our calcium and even your magnesium. Remember here that your calcium, magnesium are needed in order for you to stabilize your enzyme complex. And therefore, if you are asked what would be the specimen of choice when we are doing here the complement determination of the level of your complement or complement determination, so you should not collect your blood in your anticoagulated tube because the anticoagulant tend to destroy your calcium and even your magnesium, and therefore it will not allow the activation of your complement. So with your specimen for the complement testing, so you should use here serum as your sample. Okay, another one, we have also here your heating process. If you try to subject your sample here to 56 degrees Celsius for 30 minutes, try to inactivate your C1, C2, and even your C4. And if you try to have here heated your sample at 50 degrees Celsius for 20 minutes, you try to inactivate your factor B or try to destroy. Normal serum inhibitor, normally in our serum, we have inhibitor normally with respect to the C1. Okay, so that normal C1 inhibitor here try to prevent the formation of your complex of your C1 with your C1Q, R, and S. And storage. So if you have that, you should try to collect your specimen and try to store that one for several days before you try to test for your complement. It can eventually destroy your C4 component. Okay, then we have here the regulator of your complement activation. So these are the different factors that try to control the overactivation of your complement system. So generally, your complement system should only be activated if you have pathogen inside your body. So if not, it should be eventually be prevented here from activating because of the different factors. Okay, the first one, we have your C1Q inhibitor. So this is the inhibitor we try to inhibit here the binding of your C1R and C1S with your C1Q to prevent here the formation of your C1 complex. We have also here the factor I, primarily try to cleave here your C3B and your C3 and your C4, and therefore preventing here the activation of the next complement factor. The factor H is your cofactor for the factor I, especially for the cleaving or hydrolyzing your C3, your C3B. Then we have your C3 convertase inhibitor, so it might eventually in the form of your soluble factor like your C3b binding protein. You could also have here your cell-bound receptor that are found on the cell surface or in the receptor. We have your C1, CR1 or the complement receptor 1. This is your CD35. Then we have also your MCP or membrane cofactor protein. This is your CD46. Then we have also your decay accelerating factor, your CD55. Okay, your decay accelerating factor try to protect our RBC membrane against the effect of your activation of your complement. So generally, if you don't have that antigen antibody complex. So normally, ang mga RBC natin na walang antigen antibody complex, they are being protected because of the decay accelerating factor. However, for those patients would have here the absence of the decay accelerating factor, that would trigger here the lysis of their RBC once the complement has been activated. Usually, that one occur here in the patient with your PNH, paroxysmal nocturnal hemoglobinuria. They don't have the decay accelerating factor. Another one, we have your MIRL, the membrane inhibitor of reactive lysis. This is your CD59. You also try to bind with your C8 and prevent insertion of your C9 to your C567, 6789, 678 membrane attack complex, and therefore preventing here the formation of your last membrane attack complex unit here, which is your C9, preventing that one with the formation of the hole in the surface of your pathogen. Okay, along with your decay accelerating factor, this also identified here to be deficiency of this one also result to our PNH, paroxysmal nocturnal hemoglobinuria. And we have here another, we have your S protein or your vitronectin. So it's also try to bind with your C567 and prevent this complex to bind with the surface. And therefore prevent here the formation of the hole in the surface membrane and preventing also here the lysis of your cell. Okay, then we have here the different diseases associated with the deficiency of your complement component. Okay, so again, our complement here in our body serve as our protection, primarily helping our antibody with its function in removal of the pathogen in our body. But then again, too much activation of our complement is also harmful in our body. So like for example, in the case of your gram-negative, severe gram-negative infection or septicemia, it would trigger here the release of your C5a and C3a, and those are your chemotoxins. And eventually, it will also trigger proliferation of much of your neutrophil to your pulmonary tract to try to accumulate on that, and eventually it might result to your asphyxiation. Myocardial infarction, it has been noted also here that your C3a and C5a would have receptor to your coronary plaque. And if the patient, for example, would have here myocardial infarction, if your complement has been activated, it can trigger also to increase the severity of the damage to your myocardial heart. Myocardium of your heart. So magiging mas severe ang damage or manifestation ng AMI if the patient would have that. Okay, especially along with the activation of your complement system. Then of course here, as one of the effect of your, the end effect of our complement activation would be your cell lysis, especially for the RBC. So if that one result here, for example, for the activation complement, it result here to the lysis of the RBC, and therefore what you have would be your hemolytic reaction. Example for that, we have the PNH. So this is characterized by deficiency of your decay accelerating factor or membrane inhibitor of reactive lysis. So the RBC don't have the protection against your complement, especially for in the situation of indiscriminate complement activation. Okay, therefore, that results here to the lysis of your red cells happening during the nighttime. So it's being called here as your PNH. Okay, we have the test for the PNH. We have your HAMS test or your acidified serum test. Okay, so we have here the deficiency of our complement system and the corresponding associated with the different disorders. So deficiency of your C1, the complex C1q RNS result here to your lupus-like syndrome, and we have also recurrent infection. For the C2 deficiency, that's also result to your lupus-like. We have also here your recurrent infection, and we have your atherosclerosis. C3 deficiency on the other hand results to your severe recurrent infection and kidney disease, glomerulonephritis. C4 deficiency with results to your Neisseria infection, lupus-like syndrome, C5 to C8 would be result to your Neisseria infection. C9, deficiency, so there's no known associated disorder related to your deficiency or the absence of your C9. Then we have also here your C1 Q inhibitor. Deficiency results to your hereditary angioedema. We have also here the accelerating factor and membrane inhibitor of reactive lysis deficiency result to your PNH, paroxysmal nocturnal hemoglobinuria. Factor H and factor I deficiency results to your recurrent pyogenic infections. So pag sinabing pyogenic infection, usually those are bacterial infection which try to cause here pus forming. MBL deficiency results to your pneumococcal infection, sepsis, and we have your Neisseria infection. We have also properdin associated with your Neisseria infection and MASP2 results here to your pneumococcal disease, pneumonia. Ganun. Okay, so again, our complement deficiency can be hereditary, and usually we try to inherit that one as autosomal recessive trait. Okay, and the absence of your complement, so you have here your increased susceptibility to infection and decreased clearance of your antigen-antibody complex. Remember here that one, of course, the main function of your complement is for the removal of your antigen-antibody complex. And therefore, it can help our body primarily to remove the pathogen inside your body. So if you don't have the complement, so hindi siya masyadong natatanggal, and they keep on destroying our tissues in our body wherever that immune complex is being deposited. Okay, so we have the C2 deficiency. Again, the C2 deficiency here considered to be the most common type of your complement deficiency. And the absence of your C2 can result to your recurrent infection and your atherosclerosis. MBL deficiency, on the other hand, so MBL, mannose binding lectin, is very important na protein primarily that try to protect here, especially the baby, especially in the time wherein the mother antibodies losing its protective action for the baby, and the time wherein the baby are still is just still starting to produce its own antibody. So, ganun siya ka-important because again, nawawala na ng antibody protection ang baby. And therefore, pag wala pa siyang MBL, the baby would eventually try to be prone here to infections like your pneumococcal disease, pneumonia, or also your sepsis, and we have your Neisseria infection. C3 deficiency, on the other hand, considered to be the most severe form of your complement deficiency. Why most severe? Because again, the C3 is involved in all our pathways. So C3, involved siya sa classical pathway natin, involved din siya sa alternative, and involved din siya sa mannose binding lectin. And deficiency of that would have here severe manifestation. And okay, that results to your severe recurrent infections and of course glomerulonephritis. Okay, so thank you.